We're diving into a real puzzle in critical care today.
Yeah.
Severe tuberculosis in the ICU.
Uh-huh.
It's a disease we can cure,
Right.
but it still takes a shocking number of lives every year.
Yeah, over 1 million.
Over 1 million.
Yeah.
And what's really striking is how many of those deaths actually happen in the ICU, which just shows how tricky these severe TB cases can be.
It's interesting, isn't it? We think we know TB.
Yeah.
And then it throws these curveballs
Totally.
that land people in intensive care.
Exactly. That's what we're diving deep into today.
Right.
Our guide for this deep dive is a brand new mini review from the World Journal of Critical Care Medicine. And it just came out this past June.
Wow. So it's really
So we're talking about
the
very latest
Yeah.
clinical knowledge on this often overlooked part of TB.
Yeah.
And I think whether you are a healthcare professional, a student, just someone who likes to stay informed,
Keep up to date.
this information is relevant.
Especially
with how globalized our world is now.
Absolutely.
Now, when we think of TB,
Yeah.
we usually think of the lungs.
Right.
And while that's definitely a common presentation,
Sure.
this deep dive
Okay.
is really focusing on the unexpected ways
Okay.
that severe TB can present.
Interesting.
It's not always a cough and a chest x-ray, is it?
Not at all. So while pulmonary TB is common,
Yeah.
this review really focuses on those cases where TB can almost perfectly mimic other conditions.
Okay.
So, for example, think about neurological complications,
Okay.
like TB meningitis, which can sometimes present as a stroke.
So someone could be treated for a stroke
Exactly.
when they actually have TB.
That's exactly right. And
Yeah.
that delay in diagnosis and then getting the right treatment
Yeah.
can have some really serious consequences for the patient.
I bet.
You know, they might be given blood thinners,
Right.
which wouldn't be helpful at all for TB meningitis
And could be harmful.
and could potentially be harmful. Yeah.
Wow. So it really emphasizes how important it is for clinicians to consider TB.
Okay.
Even when the symptoms don't immediately
Scream TB.
scream tuberculosis. Yeah, exactly.
Yeah.
In fact, the review even mentions cases where patients needed neurosurgical interventions,
Oh, wow.
like needing a shunt placed because of their TB.
A shunt for TB, that's certainly not something you hear about every day.
Not all.
It really challenges our preconceptions about this disease.
It does, and it doesn't end there.
Okay.
You know, we also have disseminated TB,
Okay.
where the bacteria actually spread through the bloodstream, and they can impact all sorts of different organs.
Wow.
You know, the brain, the lining of the heart, even the adrenal glands.
The adrenal glands. Now, for those of us who haven't looked at an anatomy book in a while,
Sure.
remind us what those do again.
Of course, yeah. So the adrenal glands,
Yeah.
they're these small glands that sit right on top of your kidneys,
Okay.
and they're really important.
Because they produce these essential hormones,
Okay.
like cortisol, which helps your body respond to stress,
Right, right.
and aldosterone, which helps regulate your blood pressure.
So if TB
Yeah.
affects those glands,
Yes.
what kind of problems are we talking about?
That's where it gets really concerning.
Okay.
Because if those adrenal glands are damaged, they can't produce these hormones effectively.
Yeah.
And that can lead to something called adrenal insufficiency,
Hungry.
which can be life-threatening
Wow.
if it's not treated. So you can imagine this cascade of problems:
Okay.
severe fatigue, dangerously low blood pressure, even coma.
Wow. That's
So recognizing disseminated TB early is crucial.
yeah. And it sounds like severe TB is almost like a master of disguise,
It is. It really is.
which makes diagnosis really difficult.
Absolutely.
And I can only imagine how hard it must be for clinicians in the ICU
Right.
to be dealing with this.
Yeah, patients who are already so sick.
Yeah.
And that brings us to that next big challenge,
Okay.
the diagnostic dilemma
Right.
in the ICU.
Yeah. It's like,
Imagine trying to solve this complex puzzle, but you're missing half the pieces.
right.
That's kind of what it's like,
Yeah.
trying to diagnose severe TB in a patient who's already critically ill.
And I'm guessing those missing pieces are things like,
Exactly.
getting a good history
Yes.
from someone who's really sick,
Exactly.
or even just getting samples for testing
It can be so difficult.
when someone's hooked up to so many machines.
It's challenging, even when a doctor strongly suspects TB.
Yeah.
Confirming it quickly in the ICU
Right.
is really tricky,
Yeah.
and the symptoms can be so vague.
Like what are we talking about?
Fever, fatigue,
Okay.
those could point to so many different things.
Right.
Add to that the challenges of getting samples
Yeah.
from a really sick patient.
It's a real puzzle.
It's a real puzzle, you're right.
So even if they suspect TB,
Yeah.
Actually confirming it
Yeah.
in these cases is really hard.
It is, yeah.
Yeah.
And that's where these diagnostic limitations really come into play.
Okay.
And the review even mentions GenExpert,
Okay.
which is the rapid molecular test.
Yeah.
That's been a game changer
Yeah.
for diagnosing TB.
I thought it was.
Yeah. And in a lot of cases it is.
Okay.
But it does have its limitations.
What kind of limitations?
So its accuracy can actually vary
Okay.
depending on the type of sample that's being tested.
Makes sense.
And even where in the body the sample comes from.
Okay.
For example, if you have a sputum sample,
Mm-hmm.
that's that mucus you cough up from your lungs.
Right.
That's usually pretty reliable,
Okay.
but those can be hard to get in the ICU.
Yeah. Especially if someone's on a...
Especially if they're on a ventilator.
Yeah.
And then when you're dealing with TB that's outside the lungs,
Right.
it's even harder to
Right.
find the right sample
Yep.
to actually test. So it's not a perfect tool.
So if it's so hard to diagnose,
Yeah.
how do they even begin to manage these patients?
Right. So that's where the stakes get really high
Yeah.
because often clinicians have to start treatment empirically,
So they're like...
meaning they start those antibiotics
Right.
while they're still waiting for that confirmed diagnosis.
Wow. So they're really walking a tightrope?
Absolutely, yeah, because
They're trying to stabilize the patient,
you can't wait.
but they don't even know if they're giving the right treatment.
Exactly. You've got to treat them.
Wow.
And remember how we talked about multi-organ failure?
Yeah.
That makes treatment even more complicated.
In what way?
So someone in the ICU
Okay.
might have liver or kidney problems already.
Right.
And that can really impact
Yeah.
how their body handles these medications.
Right. It's like the treatment itself
Exactly.
could actually make things worse
Exactly.
if the body can't handle it.
Yeah,
Are there particular side effects
absolutely.
that they really watch out for?
Yeah. Yeah, because we're talking about strong medications
Right.
with potentially serious side effects.
What?
So the review specifically mentions
Yeah.
hepatotoxicity, which is liver damage, as a major concern,
Okay.
particularly with drugs like pyrazinamide and isoniazid.
Okay.
These are commonly used to treat TB,
Yeah.
but they can be rough on the liver.
Okay.
And then you also have to worry about nephrotoxicity.
The nephrotoxicity. So that's the
Kidneys
kidneys. Yeah.
coming a hit.
So it sounds like treating severe TB in the ICU
Yeah.
isn't just about like giving
It's
antibiotics.
the balancing act.
Yeah.
You're right.
It's like managing all these other complications.
a whole cascade of potential complications.
So actually,
And that's why the review really stresses how important a multidisciplinary approach is.
What does that look like in practice?
So that means you have clinicians, pharmacists,
Okay.
nurses, respiratory therapists,
Wow. So it's really a...
maybe even dietitians,
Wow.
all working together
That's amazing.
to fine-tune these treatments and monitor for side effects.
So it's really not just about what happens in the ICU.
Exactly.
It's recognizing that
The whole body.
the whole body's connected.
It's connected, exactly.
And that's why the article
Yeah.
goes beyond just the antibiotics.
Exactly. And it stresses
And it talks about this holistic approach.
that holistic approach. Yeah.
Okay, let's unpack that.
Okay.
What does that mean?
So it means thinking about all aspects of the patient's health
Okay.
and how they might be affected by the disease
Mm-hmm.
and its treatment.
Okay.
For example, the review talks about using corticosteroids. Now, these aren't meant to treat the TB itself,
Right.
but they're used to manage the inflammation
Okay.
that it causes.
So it's kind of like you're not just trying to kill the bacteria.
Okay.
You're also trying to manage
You're managing the body's
response.
response to it, yeah.
Are there other
Pieces
pieces to that?
Because sometimes the body's own immune response
Right.
can be a little too enthusiastic.
Oh, no.
The review even talks about this thing called paradoxical drug reaction
Okay.
or immune reconstitution inflammatory syndrome.
What?
IRIS.
What is that?
So you can think of it like this.
Okay.
You start treating someone for TB.
Okay.
The drugs are working, the bacteria are dying,
Great.
and then their symptoms get worse.
How is that possible?
It's kind of a double-edged sword.
Wow.
Basically, as those TB bacteria die off, they release cellular debris and toxins.
Okay.
And those things trigger the immune system.
Right.
Now, in most people, this is controlled and it helps clear the infection.
Okay.
But in some people, especially those with weaker immune systems, it goes into overdrive.
Oh, wow.
So it's like the immune system is on high alert and suddenly it's just flooded with alarms. Oh, no.
And that causes more inflammation.
So you're fighting the infection.
Right.
And you're also fighting the body's
You're managing
the body's response to it.
the body's response to it, yeah.
Yeah.
And then on top of that,
Yeah.
the review also points out
What's that?
that hyponatremia,
Hyponatremia, so that's low
sodium,
sodium, right?
yeah,
Isn't that something?
it's common in the ICU in general,
Okay.
but it seems to be
Yeah.
particularly an issue
Okay.
in these severe TB cases.
And that can be dangerous?
It can be really dangerous, yeah.
So they have to monitor those levels
Absolutely.
really closely.
Really carefully manage fluids, yep.
It's just another example
It is.
of how complex these cases can be.
It's not just one straightforward problem.
It's like a web
It's a web
of interconnected issues.
of interconnected issues, you're right.
Yeah.
And that's why this review is so valuable.
Yeah.
Because it highlights these complexities.
Yeah. And it stresses
Mm-hmm.
how important it is to tailor treatment
Yeah.
to each individual patient.
This has been eye-opening.
It is fascinating, isn't it?
We've gone from a cough
Yeah.
to multi-organ failure.
That's right.
We're talking about diagnosing it,
Mm-hmm.
treating it.
It's a lot.
It really does sound like you need a whole different level of expertise
You do. You really do.
to manage these patients in the ICU.
It's amazing what these clinicians are doing
Yeah.
because they're making these huge decisions, life or death decisions,
Yeah.
often without all the information they need.
Yeah.
It's incredible how much skill it takes
Right.
and dedication to really navigate all of that
Yeah.
and still try to get the best outcome.
Speaking of outcomes,
Yeah.
the review did mention that severe TB,
Right.
even with the best care,
Yeah.
still has a high mortality rate.
It does, yeah.
It's just really sobering.
It is, and it really emphasizes
Yeah.
everything we've talked about today. The importance of diagnosing it early,
Right.
having the right treatment strategy,
Yeah.
being really careful about watching for complications, and then, of course, prevention.
Which, let's be honest,
Yeah.
prevention's always a good strategy.
You're right, an ounce of prevention's worth a pound of cure.
Exactly.
And in this case, it's not either.
Right.
We need both.
Yeah.
We need to prevent TB,
Yeah.
and we need good treatments.
Okay, so let's talk about prevention.
Okay.
What are some of the key takeaways?
So the review really stresses
Yeah.
how important that BCG vaccination is,
Okay.
especially in areas where TB is really common.
For those of us who might not be familiar,
Yeah.
can you give us like a quick
Of course, yeah.
BCG 101?
So BCG stands for
Yeah.
Bacillus calmette-guerin.
Okay.
It's been around for about 100 years,
Wow.
and it's made from this weakened strain of bacteria
Okay.
that's related to the one that causes TB.
Okay.
And while it doesn't prevent TB perfectly in everyone, it's really good at preventing
Yeah.
severe forms of TB in kids,
Well, okay.
like TB meningitis.
So it's a key part
Absolutely.
to protecting those
Yeah,
most vulnerable.
it is, yeah. And then the review also talks about contact tracing.
Okay.
So that's when, if someone has TB,
Mm-hmm.
public health officials will
Right.
try to find and test anyone they've been in contact with.
Okay, to stop the spread
Exactly.
before it even starts.
Exactly.
Makes sense. What about in the ICU?
So in the ICU, it's all about infection control.
Oh,
Really careful practices.
So like what are we talking about?
Things like hand washing,
Great
wearing
stuff.
masks,
Mm-hmm.
isolating patients who might have TB.
Yeah.
Those are all standard procedures.
And honestly, that sounds like a good idea no matter what.
You're right. Basic infection control
Right.
goes a long way.
Yeah. Are there other things they do?
The other thing the review mentions is managing those risk factors we talked about earlier,
Okay, right.
HIV and diabetes.
Right. So it's really a comprehensive approach,
It is, absolutely.
looking at both individual things
Yeah.
and bigger picture societal factors.
It's a huge problem.
This has been really eye-opening.
It is fascinating, isn't it?
It is.
TB is one of those things
Yeah.
that's been around for so long.
We think we know it.
And you think we've got it figured out.
Right.
But then it throws you these curveballs like we've been talking about.
And it really highlights how important it is
Absolutely.
to keep learning about it.
Yeah.
Absolutely.
Any final thoughts before we wrap up?
I think the biggest takeaway for me is that
Yeah.
behind all the statistics and the research,
Yeah.
there are people.
Mm-hmm.
These aren't just numbers on a page.
That's a good point.
These are real people who are going through something really serious.
It's a good reminder for all of us
It is.
that even with diseases we can cure,
You're right.
we still need to be vigilant.
We need to understand them deeply,
Yeah,
and we need to be committed to prevention and treatment.
absolutely. And to our listeners out there,
Yes.
the next time you hear about TB,
Yeah.
Remember that there's often a lot more to the story than you might think.
It's not just a cough.
It's not just a cough.
Well, thank you so much for taking us on this deep dive today.
It's been my pleasure.
It's been really insightful.
Thank you for having me.
And to our listeners,
Yes.
thank you for joining us.
We'll see you next time.
We'll see you next time.